Hi everyone, welcome Diaries here. My name is Dr. Ark Safarov, and I've been in the United States for 11 years and a tail, and being a foreign trained dentist, international dentist all this time, just like many of you subscribed or continuing watching. I would like to talk about why the dental hygiene license is the go for us. I have been emphasizing it for my clients since 2019. I started my work and my mentorship for so many clients, and about 300 clients already been through me, whether they just choose very intuitively limited consultations with me or complete workflow where I would work with them for a year until their graduation. Yes, I do have successful cases, which I'm very proud of. I think that it doesn't mean that you need to replace your hygienist work. And I'm going to be talking specifically for now about the open path of Florida. Uh, you're not going to replace your dental assistant work. You still have to do dental assistant job as a non-spoken requirement because the scope of the coverage of the functions of the duties of dental assistant is various, is completely great in a way if you are doing it for advanced standing program, which is general dentistry program. So you have to have American or Canadian general dentistry dental assistant, hopefully with extended functions. If you can get that license, that would be even great, and show it to your profile. Why am I emphasizing that the dental hygienist license, specifically for now the open pathway, is in Florida, which is very easy, which is about 16 maybe $1,700, including transportation maybe. Sometimes you need to get to a different state. Okay, maybe with flight tickets and hotel it's going to be $2,000, which would include $1,400 for 3 exams, hopefully passed with the first attempt. And this is why I'm here right now speaking for you, and I'm working towards that. I've been combining so many materials, and all of them 100% with a successful 100% rate helped those who inquired to my materials that I created and I reshaped through all these years. I think that it's a very cheap, it's one of the cheapest investments you can get. Imagine you get not only a hygienist license in your profile to apply for dental general programs, whether it is advanced standing international programs in the 30 universities plus, or it is AEGD or general practice residency. They all will say, oh, this guy has been not just assistant, but he has been a dental a licensed certified provider. Just like a dentist is a provider, dental hygienist is a provider of the treatment, of diagnosis, co-diagnosis, and recommendations to the patient. That's a completely different level to be a provider versus just an assistant or a lab technician, which is also a go. Now, it is not just that's going to show, oh, in your profile, you're great, you're a clinician, now you have those skills, now you having the turnover rate on your chair, you've seen so many people, you talk, you communicate with the patients directly, they communicate to you, they start building trust, blah, blah, blah. It is also a great money income. It is 1.5 greater than, on average, in any state, than dental assistant job. That very minimum 2,000, let's say, dollar investment, you're gonna beat up you're gonna make up in 2 months with savings. Honestly, I've been a dental assistant for too long in the US, for 9 years, I would say, and I wasn't able to save as much as I could. I was basing on my family savings. My parents has been helping me somehow, and Also, my wife has been helping me when I got married about 5 years ago. We all kind of accumulated our funds, and it doesn't mean that I haven't been working. I have been working, and even on the weekends, like normally 6 days a week. But it would eat up all energy towards the exams, IMBD exam. I have passed the part 2 and part 1 attempts. So this is a little bit of my story, and I have been failing it. So is it fail because you are stressed, you have a lot of work hours a week, so you don't have energy too much to study. So it's very hard to balance, honestly. I think with dental hygienist job, it is a little bit easier if you skip weekends and you'll be able to study. What I'm saying is, with more income as a dental hygienist, you're gonna be able to, money dictates the difference. Okay, some mentors, just like me, do not recommend becoming a dental hygienist. And this is their personal opinion. I understand that, because dental hygienist is a very narrow job that would include just a light scale or scaling, deep planning, anesthesia, maybe whitening if extended duties, and sealants, applying sealants. Now, it would exclude assisting in various interesting procedures like ortho, endo, oral surgery, crown fabrication. You tell me. This is why I believe, and I agree with those mentors completely, this is why I believe you need to do 2 jobs. You need to start with dental assistant, obligatory, you must, and then you continue with dental hygienist. And obviously after dental hygienist, you won't be able to downgrade your paycheck rate, right? You're not gonna go back to dental assistant, no way. Unless for some family reasons you're gonna move out of Florida. Now there are also other states like Massachusetts and forgive me if I'm wrong, Minnesota, and also I believe Arizona is upcoming, but it's not in the present state. Maybe in 2027 or likely 2028, they will be allowing the easy pass, or maybe also Indiana, by the way, I heard. Now, don't catch me on those specific states, right? You also have to go to their websites and track their eligibility. But I've been bombarding the emails to Massachusetts specifically for a good year until I stopped, because it's easier to check on their website, like search, are they actually doing it right now? No, they're not, right? So many other states don't. Okay, back to the conclusion. I do have files that I've been working on, materials that so many, I believe around 40 of my customers bought them from me, and with a 100% rate successfully passed it. They are files for 2 exams. First one is the hardest, I would say. It's 53 questions, laws and rules of Florida in dentistry for dental hygienists. Please do not confuse it with a dentist variation of that exam. It's a different exam with different questions. So I do have those 3 files that I've been shaping, I've been modifying, and I have been check proofing. So those are for you. They would take, I would say, a week to study if you study 4 hours a week. But you study consistently without any disruption, okay? And another exam is the computer-based simulated exam, also on the computer. Now, don't confuse, these 2 are not mannequins. For mannequins, it's another chapter. You can consult with me. I will give you some guidance as well, especially if you become in my mentoring, which I will talk about in a minute. But for that exam, computer-based clinical exam, it's about 100 questions or so, about same timing for the exam, and I also sell those files, right? So you can inquire to me, and I sell those files for the minimum amount, understanding that, hey, you already spent $1,400 without even going somewhere, or maybe even more. So that minimum guarantees you to pass the exam. What would you think? What would you pay for that minimum that guarantees you pass the exam, and pay another similar amount for the retake of the exam, compromising your timing, because your timing dictates your money, your how soon you're gonna get that license and get the higher cash paychecks. So this is a must. Also, it dictates the timing because you want that hygienist license to be sooner in your profile, the date on it. So I think it should be a priceless amount, right? It's priceless. But I put a very minimum price there for you, very minimal fee that you all can afford without hesitation. And I actually hate customers who, I have those customers who either buy them unconditionally without asking for any, oh, what's the guarantees, what it does include, and they would buy and they decide right away because they know what I just said, timing matters. And hey, here you go, here's the files. I would send them in the very shortly after the payment received. And there are other completely opposite side of customers who would inquire, oh, what is it? Can you give me details? And they would never buy it from me. And please be more straightforward with yourself, not with me. These files are for you and for your timing. You're not helping me much to get those small pennies. I'm just doing it because I put a lot of work. I put a fee on it because I put a lot of work in those files and a lot of my timing and expertise for years. That being said, inquire. Please text me in my Telegram or Instagram, but I do prefer Telegram. Your Dr. Ark, I wish you pass your exams, and I wish you get your dental hygienist license, because it is really good white green flag for dental admissions to get a hygienist in the program. Why? Because there's a lot of dental hygienist curriculum and procedures at the any general dentistry program that would get you the license as a dentist in the United States. Happy to be helpful.